Welcome and thank you for joining us on another episode of Ponea TV. I am Dr. John Kyalo. I work at Ponea Health, offering a clinical perspective to the development of our products in the technology space.
And my name is Daniel Mumo. I work in the clinical operations department with a particular focus in the quality assurance of the providers that we bring on board our platform.
Our topic for discussion today is the disparities in healthcare provision between the public healthcare sector and the private healthcare sector. Daniel, what would you say consists the public healthcare sector?
Well, the public healthcare sector is quite multifaceted. It was developed to cater for the needs of the society as a whole. So as such, it caters for all our preventative facilities, which include vaccination programs. Through the efforts together with the WHO, for example, we have managed to eradicate polio in the country. So this is one of the vaccinations that has been largely effective in Kenya and in the greater world region. We also have our standardized KEPI vaccines, which is our Kenya protocols for immunization vaccines for children up to the age of 2 years old. So this has all been developed in a bid to cater for the preventative aspect of our healthcare. Yeah, we have community health workers who work also in the grassroots regions of the country, who are typically involved with facilitating home visits to anyone who is in need of continuous medical care. We also have our public health sector, which is involved with just mandating and coming up with the legislations which are necessary for the protection of our citizens. So that is the first aspect or the first pillar of the government sector.
And we've also got some educational programs that cater for disease prevention. These are largely carried out by community healthcare extension workers, as well as community healthcare workers who work at the grassroots levels, as you explained.
Yes, exactly.
Yes. We've also got as well the diagnostic side of the public healthcare sector. This has been championed by the government in terms of rolling out diagnostic services and equipment to the regions within the country, which have enabled diagnosis to not only be centered in the densely populated areas around the city, the capital city, Nairobi, but also in the outskirts of the regions in our nation.
Right. So in addition, we also have then the curative aspect. So the government has essentially set up various referral hospitals at strategic points throughout the country. We have, for example, here in Nairobi, the Kenyatta National Hospital. In Eldoret, we have the Moi Teaching and Referral Hospitals, as well as a variety of other level 5 and 6 hospitals which have been peppered around the country, which are essentially providing support to the larger auxiliary healthcare structure that we have in our country. So these three pillars essentially are amalgamated together to bring up the whole public healthcare sector and to largely serve the citizens of the country.
And now when we talk about some of the challenges that face our public healthcare system in the country, I think it's pretty it's common knowledge that we have challenges with accessibility, with quality of healthcare.
Yes.
And we've also got challenges with affordability of healthcare. I think the first thing we'll talk about is accessibility. Due to the high numbers of patients that would primarily be able to afford public healthcare, we have facilities being overstretched, in terms of resourcing, whether it's personnel or equipment, in the sense of personnel or equipment, right? We've also got challenges with quality of healthcare, which all boils down again to the challenges that are faced in terms of resourcing, resourcing in terms of human resource, as well as equipment.
Yes, so just to add on to the resourcing aspect, the WHO largely stipulates that healthcare should receive a 15% budgetary allocation, but is in the recent budget that was read, in the 2021 to 2022 healthcare budget, healthcare received only a 3% allocation. So because of this shortcoming, we tend to see the gaps in our healthcare, in our public healthcare infrastructure, where we are unable to resource, for example, for human resources. We're unable to pay the doctors that we require to pay to have them in the hospitals. We're unable to purchase the equipment and medications that the patients need in the public hospitals. So this is one of the largest gaps that we are finding ourselves having in the public healthcare sector, largely due to the oversight in the budgetary allocation.
And this comes into play as well when we talk about maintenance of the equipment that has been purchased and replenishing of the medical supplies in terms of lab reagents required to run lab tests, and even medication that is prescribed to our patients.
Exactly. So it turns out to be a domino effect where we have inadequate funds, which now lead to inadequate equipment, which now compromises the quality of the healthcare that our patients receive in the public sector. I think other challenges that we are facing in our public healthcare sector turns to the poor adherence to the standard operating procedures which have been set out for the care of patients. So each hospital largely has its own protocols that it follows, but these are largely guided by the national government, the MOH, Ministry of Health, and the WHO, the World Health Organization. So the standards have been set, but we find challenges with the adherence to the SOPs which have been set. There are multifaceted aspects which have caused this. Dr. John Kyalo could explain a bit more about them.
So the laxity in following of these SOPs is also linked to the poor incentivization, that is offered to the players in the sector in terms of enforcing these. This is evident particularly in legal aspects of healthcare, where we're able to see there's not as much follow-up in terms of legislation that is made in cases where it's required in the public healthcare sector.
So some of the shortcomings of this public healthcare sector have necessitated the need of the private healthcare sector to now come up and supplement what the public healthcare sector is offering in order to bolster the well-being of our citizens. Yeah. So this has been now again a hand-in-hand walk between the public and the private sector to again bring about good healthcare for all our citizens. So thank you for coming to another episode of Ponea TV. In the next episode, we will look into the private healthcare sector and its benefits and shortcomings as well.